The following portion of Daytime is sponsored by Clinique of Plastic Surgery. Welcome back, everyone. Each year, millions of Americans visit a plastic surgeon to make themselves look more like the age that they feel. It's critical to do your homework before choosing a doctor to perform your procedure. Dr. Christian Drehsen is the first physician in the United States to perform stem cell enhanced facelifts and facial rejuvenation. He's here to explain how that works and show us some dramatic before and after photos. Doctor, before we go any further, I just want to start off by saying sometimes people get a pretty big reaction towards stem cells, but we're talking stem cells from your own body, right?
Exactly. It's coming from your own fat, so no embryo involved.
Okay. All right, and you are now seeing a lot of baby boomers these days. There are a lot of people out there who are coming to you saying, okay, I just don't look the way I feel.
Absolutely. I mean, look help your relationship, look help your business. And therefore it's really important, especially with a large amount of baby boomers coming into the age of retirement, to maintain either a strong business position, and they like to maintain the youthful look. You know?
And I know a lot of times when people hear about these types of surgeries, they hear invasive and non-invasive. Could you kind of elaborate on what that means?
But in non-invasive have been obviously on the increase for the last few years, and especially in view of the recent recession. You know, people were looking for a quick and hopefully not too costly way to improve their look. The problem is that obviously it's a very, very limited improvement. So a lot of gimmicks have come over the past few years inside as well, based on the supposed economy. You know, people realize that gimmick don't work. So people are looking now for a really effective way. And what I do, I think, is giving you a very effective, long-lasting rejuvenation that undoubtedly everybody around the world will notice. Well, you've got some examples of emoticons just to show that how people perceive you can come from just the expression on your face. And there we have, it's about changing those things, right? Your brows start to sometimes go toward each other, and people might think you're in a bad mood, but really you're not. Yeah, absolutely. I mean, the emoticon is a very simple way to express what I try to do in cosmetic surgery, to try to give you a more pleasant, a more dynamic, refreshed look. It's not only based on pulling and tucking the skin, it's based also on bringing more volume, restoring the position of the brow in the right place. And obviously that's what you're going to notice when you see the following example. Well, let's take a look, because we mentioned dramatic before and afters. As you can see, I mean, her facial expression seems to be totally different to what she is normally. And she has this very strong brow expression, make her look unhappy or upset. And most of my patients, when they come into my office, I tell them, I say, do people tell you look upset or you look tired? They tell me that all the time. I'm a happy person, I'm not tired, and therefore I really like to change that impression I give. And I think there's a way to do it, and you can see it with the type of procedure I do. Well, I can see where the transfer of the stem cells really makes a difference, because you've given her fullness that a lot of people lose as they age, and this woman as well. It's dramatic. Yeah, but this patient have had all a combination of a lift, obviously, that bring back the skin where it should be, and also volume restoration. The volume restoration is done with fat, and more recently, the stem cell has been added. I've been so far doing it for people who have tremendous amount of skin damage, or people who have also a need for a large amount of fat. I see a lot of women with a very sunken face that don't look really healthy. It's very nice to be able to restore that fresh and healthy look. And doctor, what would you say to somebody that's considering getting some procedures done? What would you say? Well, I'd say get a consultation with a well-trained plastic surgeon, and somebody can show you also what type of result he has obtained and his view of aesthetics. I mean, that's a really important thing. It's like looking at an architect and saying, well, I'd like to see a few examples of what you have done, and I will judge by myself. Thank you very much. Hey, to meet Dr. Drehsen in person and to hear more about the stem cell enriched refresher facelift, you might want to attend their upcoming seminar, Taking Cosmetic Surgery to the Next Level. It will take place Saturday, February 26th at the Tampa Renaissance Hotel from 11 a.m. to 1 p.m. with registration starting at 10:30. Reservations are required and can be made by calling 727-592-0991 or 800-942-1606. The preceding portion of Daytime was sponsored by Clinique of Plastic Surgery.
Incredibly easy. And now all we're going to do is whisk this together.
Okay.
And we're going to pour our filling.
these.
Thank you. I need to take you home with me. You're so helpful.
I try.
We're going to toss this together just with a whisk, and all you're going to do is let it get good and mixed up, and then we're going to go in the oven.
Okay.
And this just cooks for a few minutes at 350, super easy, and then you're going to chill it.
So the crust goes into the oven for how long? 15 minutes, you
15
said?
minutes,
And what temperature?
At 350.
And then you just pour this in and put it back in?
And put the pie in, yep.
Okay, okay. That's great.
All righty.
Oh, that looks yummy. That's a pretty looking pie already.
Isn't that beautiful?
Yes, yes, and we haven't even decorated it
Haven't
yet.
even decorated. Now here comes the fun part. So let's
Okay.
do some decorating.
Okay, here's the finished pie.
We've got one that's finished. Now that was baked and then put in the refrigerator for about 4 hours. That'll completely solidify everything. And the fun part is then to get a little bit of whipped cream. Now this is real whipped cream. We've used whipping cream that we beat in the mixer with a little bit of powdered sugar. I'm gonna give you 2 spoons.
Okay.
I'm going to take 2 spoons, and we're going to dollop this on the pie. So what I like to do is grab a big spoonful,
Okay.
and then just pop him on there. And you can use your little spoon to help.
Can I look at the picture? Are they?
Yeah, you need some inspiration
well,
over there.
Are they supposed to touch each other? They're supposed to be
You
separated.
can touch each other, and this is the kind of thing, if you want to, this is where you can make it your own if you want to. Here, I'm kind of hogging up
Well,
the...
yeah, you are. You can anyway. Okay, we're
whipped cream
about
there.
to run out of time here.
And then,
look
how
at that.
easy is this? You've got your whipped cream on there.
Okay, I want one more dollop on
Take your lemons.
There we go.
Look how pretty that is.
Oh, that is gorgeous.
You can
That
throw
is
some mint
gorgeous.
on there.
For this recipe, folks, and for more great Southern Living recipes, you can go visit southernliving.com or daytimeonline.tv.
I think we did pretty good,
I
don't
think
you
we did a darn good job. Looks almost as good as the one on the cover.
Looks just like it.
Rebecca Lang, thank you very much.
Thank you, Dave.
Be right back.